Thank you for watching On Call for All Kids. Today we're talking about how to manage our household while the kids are out of school due to coronavirus. We're going to be talking about the importance of structure and routine, how to help kids keep up with school lessons, and how to maintain self-care. I am joined by Dr. Jennifer Katzenstein. She's the Director of Psychology and Neuropsychology here at JohnsHopkinsAllChildren'sHospital. Hospital. And it's great to have you here, Dr. Katzenstein.
Thanks for having me.
Yeah, very uncertain time right now. Scary for a lot of families and especially kids.
It is. It's very stressful and anxiety provoking. And I think it is an opportunity for us to come together as families and communities and support one another, but it doesn't take away from the uncertainty that we're facing.
It could be our new normal, this whole era of uncertainty and not knowing what's next with the coronavirus situation always developing. How can we still kind of keep structure within our family unit right now?
It's really important to maintain our sleep routine first and foremost. So we want to keep that bedtime routine the same and the bedtime the same, as well as the wake up time and the morning routine. And that means meal times stay the same and we still get dressed for the day and don't end up spending too much time in our pajamas. But also in terms of the virtual schooling from home, we would be really beneficial for all families to make a schedule. So to be able to have that schedule posted on the fridge or somewhere in the home that has bedtime, wake up time, all the meal times, as well as any times we're dedicating to virtual school, to other activities, to some screen time, or even an opportunity for some physical activity, whether that be inside or outside.
How do we incorporate that physical activity into our daily routines?
It can be a challenge right now, but I think that there are great opportunities electronically on apps or on YouTube or other devices where we can take a look at what's available for a free workout for the family. What about some yoga? Even getting outside, running in the backyard, playing some kickball or soccer in the backyard, or taking a family walk and maintaining healthy social distancing from others who may be out walking too.
Well, we want to stay healthy during this time, and we keep talking about washing our hands to avoid getting ill, or obviously we're trying to all stay at home to not spread the virus, but we cannot overlook our mental health too, and that's why we're speaking to you about this very important topic. What type of behaviors should we be looking for in our children that warrant, hey, something's going on here, we need to dig a little bit deeper into this?
This is an incredibly stressful time for everyone. Absolutely watching for irritability, changes in mood, increased anxiety or stress or tearfulness in our kids. They're certainly likely to be more clingy during this time and even acting out a little bit more to get your attention. So if you can find 15-20 minutes every day to check in and do some communication, and even better if you can do some activities together without screens present, that 15-20 minute check-in is going to serve you well later on in the day to get some other work done.
Important for us as parents too, or caregivers, to also take time for that self-care, right? Because our kids are feeding off of our energy and how we're feeling.
They absolutely are, and I think it's so important for us as parents to monitor our own stress and anxiety, monitor how our body is feeling. Often when we're stressed or anxious, we start to get sweaty palms, our heart starts to race, or we get that feeling of dread in the pit of our stomach, and that can cause us to react or be more irritable or say something that we didn't mean. So it's incredibly important now for us to be taking care of ourselves, taking a minute away from everyone to take some deep breaths or recenter. As a mom, that may mean a few tears and then recovering and coming back, because I think this is a time where we all have to give each other and ourselves some grace.
I gotta say, sometimes it feels good to just have a good cry, and let it out.
Absolutely, and even during this time, knowing that things are probably becoming tense in households. We're becoming stressed by not having the ability to just go out and do what we wanted to do when we wanted to do it. Or if there are grandparents or other caregivers living in the home that aren't usually in such tight quarters, and our kids aren't getting out to burn off all that energy that they have, then we really can see that increase in stress and anxiety, and that can bubble over. So it's important to watch that really closely and to seek out assistance if you need it. So if we're meditating, calming down, getting physical activity outside, and still having some concerns with mood or behavior, absolutely reach out to your pediatrician, to your mental health care provider, and be able to get some additional support during this time.
And you've always said, just be easy on yourself. It's hard. If the kids are on screen time a little more than they normally are, it's okay, don't beat yourself up.
It's okay. If you get to get that conference call done because someone got an extra hour of screen time, good for you. You got that conference call done. And at this point, making sure kids know that we're relaxing our screen time for the time being, but also that is an opportunity for us to do our work, So they get to have a little extra bonus.
Yeah, it's going to be a big balancing game, all this.
And it's going to change day by day. So as parents, we'll do the best that we can keeping routines and providing that calm household for our kids. But you're right, we have to provide ourselves grace and those others around us grace as well during this point. Everyone is feeling that stress and anxiety.
Yeah. Well, Dr. K, thank you so much for being here and being a great resource for us. I'm sure we'll be having a lot of conversation with you throughout this whole process.
Thank you.
If you have a topic you would like us to look into, you can comment below right here on this video. You can also check out our website. We have a lot of information about coronavirus right now. It's HopkinsAllChildren'sHospital.org/coronavirus, and you can check that out to learn a little bit more. We'll see you next week.